Parents often ask, how do I know if my child has hip dysplasia? Since hip dysplasia occurs really only 1 in 100, we need to have a trigger to get an ultrasound. An ultrasound is the method by which we can make a definitive diagnosis of hip dysplasia. So what are the triggers? First of all, there's the history. Is there been anyone else in the family that's had hip dysplasia? Was the child born from a breech presentation? Was there low amniotic fluid? Were there twins? After the birth, were there other packaging problems such as torticollis or metatarsus adductus? Any of these triggers in the history should immediately send the child for an ultrasound at the 6-week mark. On the other hand, there are other clinical findings that need to be looked for. That's why it's so important that from the time of birth through all of the regular maternal child and health nurse checks and the GP checks that the hips be looked at. What we look for, first of all, are the hip creases, the creases we see in the thigh from in front and behind, are they symmetrical? If they're not symmetrical, we need an ultrasound. Now the reality is that 25% of normal hipped babies have asymmetric creases. However, 100% of dislocated hips are asymmetric. So it's just something we need to tick off and make sure that it's normal. On clinical exam, your practitioner will check out how wide can they get the hips apart. We know that hips that are tight are more likely to have underlying dysplasia. Again, any concerns, get an ultrasound. If the leg lengths don't appear equal, get an ultrasound. Finally, the practitioner will perform tests such as a Ortolani or Barlow test to check the stability of the hip, and if there's any concerns, get an ultrasound. From my point of view, I feel the key is that when we have a suspicion, either by history or exam, that we do proceed with ultrasound. We know that the key to getting a great result is getting our child in their Dennis Brown bar as early as possible. The good news is that you can rest assured that if your baby is diagnosed and treated early for their hip dysplasia, that they'll go on to run, jump, play sports, and all the things kids are supposed to do with no problems at all.